Hi, my name is Emma, and I'd like to introduce you to Billy. Billy was bitten by his dog Sadie, and he immediately rushes to his local hospital ER. But after 11 hours since he first got there, his wound is still untreated and the room isn't any less crowded. Billy's case is one of thousands who have experienced Ontario's growing ER wait times. This past December alone, Ontario patients waited in ERs for an average of 24 hours before getting admitted to the hospital. The average time to see a physician is 118 minutes, a three-time increase from 2010. ER wait times are the worst they've ever been, and the problem is multifaceted. And we can summarize the problem with the acronym MAP. M for misplaced budget, A for administrative burden, and P for policy misalignment. These problems are deeply rooted in Ontario's infrastructure, and on the surface, they manifest in the form of these prolonged ER wait times and staff shortages. And while the Ford government is currently building a digital record system to address administrative burden and amend bills like Bill 124 to increase nurse wages, our team directs our attention to alleviating the primary symptoms of Ontario's healthcare crisis, the overcrowded hospital ER. We ask you the question: would you rather wait 6 hours at your local hospital ER or drive 2 hours and wait 1 hour at a different hospital? Our solution is to rewire patient traffic. Meet Flow, a patient-centric app that displays live hospital wait times on a centralized platform so patients can take hold of their health outcomes when the system cannot.
Let's say Billy chooses to use Flow. He allows Flow to track his location and types in emergency service. What sets Flow apart is how we add live driving time into the equation. The results are automatically sorted by hospitals with the smallest drive plus waiting time. Clicking on the hospital shows more stats like the number of patients in queue. The ability to see both driving time and wait time will revolutionize the way patients choose their hospitals and is the key in redirecting patient flow. And here's the catch: the technology to monitor wait times already exists. The problem is that this information is localized to each hospital's website, and not every hospital provides this information. What Flow is two-pronged. We will work with hospitals without this technology to implement a tracking service, and we will centralize this data on our app so patients have easy, efficient access. And why is this all important? Well, we found that there's an average 2-hour wait time difference between ERs in the same city. While this information may be unknown to people like Billy before Flow, it won't be a problem now.
The availability of ER wait time tracking technology and the Google Maps API, which can be used to make live drive predictions, will streamline Flow's production and not generate high operational costs. Ideally, collaboration with the government would help achieve full centralization and get Flow into every Ontario hospital. Due to the benefits to various shareholders like doctors, patients, administrative staff, and the health ministry itself, this is highly feasible. Flow's non-intrusive implementation and low maintenance ensure compatibility with various hospital systems, promising a smooth transition into various hospitals.
A recent similar implementation in Winnipeg has seen modest improvements in wait times, which is a fantastic start. However, while their program was localized to a city of 6 hospitals, our app would be able to cover all of Ontario, allowing patients to choose from over 400 hospitals. This aims to diffuse patients across a wider area, with the goal of hospitals operating at 85% capacity instead of 110%. We project patients to be able to see physicians in 1 hour instead of 2 and get sick beds in a quarter of the time it takes them now so they can receive the timely and effective care they deserve.
Finding the shortest ER wait time manually is an extremely tedious process, which can contribute to the high patient concentration in certain hospitals and not other nearby options. While the Ford government focuses on creating systems to address the bone-deep problems at the root of our healthcare system, Flow offers an immediate feasible solution to Canadians. In an era of proliferating wait times, an aging population, and an overwhelmed hospital staff, the time to act is now.
And remember Billy? With Flow, Canadians like Billy will have access to hospital wait times, allowing them to make the best decision for their health outcomes when the system cannot. Meet Flow.